Good morning. Today we have our patient Ingrid with us, who has suffered with Achilles tendonitis and has had a successful round of treatments using laser. Ingrid has been a chiropractic patient for many years but works in the medical profession, so she understands healthcare from both sides of the perspective. We found that after a 3-year battle with Achilles tendonitis that Ingrid wasn't having any success with any of the traditional treatments. So she was one of the very first patients that came in and had her Achilles tendonitis lasered. Today I'm going to show you a little bit more about what laser is and what it does and how we apply it to this particular condition. We have the most powerful laser that's available for medical treatment currently, a 60-watt laser. Laser has 4 components to it. It's wattage, which is the amount of power or packages or joules of energy we can deliver deep into the tissue. Secondarily, it's a particular wavelength that is designed to reduce pain and inflammation, which is what most patients tell me they're looking for. Over time, if you deliver large packets of energy into those tissues, it accelerates the healing of the tissue. If you look at our website, you'll see a 3-minute animated video that does a great job of describing the processes that go on underneath. And as a chiropractor and a physician, I'm excited to have patients' chronic pain levels turn off and become more normal again. So we're going to treat Achilles tendonitis today. I'll describe on Ingrid first of all what that is, and then we'll go through a treatment protocol. You can see from the video that Ingrid's tissues, the gastrocnemius muscle, there are 3 muscles that make up this particular muscle group, and they all come together on the Achilles tendon, which attaches under the bottom of the heel. We can see today, because Ingrid has been on her feet 40 or 50 hours a week, that this tendon has gotten quite inflamed. In the past, she's had 3 to 6 treatments initially to get this pain under control and the inflammation, and is now back for just some periodic treatment, 1 or 2 visits to try and maintain that success. We have donned our safety glasses and placed the patient in a comfortable position, and now we're going to begin with the treatment. You can see by the red light, this pointer light, that the laser is being directed very specifically into these tissues, and this laser is unique because the lens is raised 1 inch off of the skin. As those laser packets of energy reach into the tissues, they create ATP production inside the mitochondria. Mitochondria is these little powerhouses inside each of our cells, and ATP production is the energy that the body utilizes for all of its processes. The first thing that happens is we're turning off the pain fibers and inflammatory processes by putting those packets of energy 3.5 inches deep into the tissues effectively. The next thing we're looking for is the tissue to warm up, and in many cases you'll see a bit of a pinking up of the tissue as the body uses some of that energy and dissipates it in the form of warmth or heat. Patients tell me they really enjoy that part of the treatment, and it's very soothing and relaxing. We move our wand at the patient's comfort level, so if they like it a little bit warmer, we can slow down the pace of how we deliver those packets of joules of energy, or we can go quicker in order to accommodate tissue that is a little more sensitive. We don't have too much pigmentation on Ingrid's Caucasian skin, so therefore the packets of energy pass through the skin quite easily and go deep into the structures. When she has a deep tan, or if she was African American, we would have more pigmentation to work through, and therefore we would have to go at it just a little bit slower and be aware of the fact that that energy might be trapped at the tissue on the surface. So this treatment will deliver approximately 10 to 12,000 joules of energy into this one treatment area. We can go up to as much as 20,000 joules depending on the patient's need and their comfort level. Turns out as the patients have treatments over time that they tend to be able to take more energy in the body, and the body knows how to use it effectively for pain relief and healing. So if you're having anything similar to this, plantar fasciitis, Achilles tendonitis, give our office a call and we would love to take you through a demonstration and show you the effectiveness of it. I think the key with laser is that you almost have to feel it for your own body to see how it works effectively. So thank you for taking the time, and we'll give you a progress note with Ingrid as we go along.